Hey, I'm Dr. J with Vital Chiropractic and Wellness, and I'm sending you this video because you have either been diagnosed with a disc injury or I'm strongly suspecting one. Disc injuries require a different conversation than routine chiropractic care. So this video will help you understand what's happening, how to manage it, and how we prevent future flare-ups. But let's start with what a spinal disc actually is. The discs are soft tissue cushions between the bones of your spine. And they have two main parts. There are outer rings called the annulus fibrosus, which are very tough concentric layers of tissue. And then there's an inner center called the nucleus pulposus, which is a gel-like material with very high water content. The outer rings hold the gel in place, and because water is not compressible, the gel pocket is excellent at supporting your body weight and absorbing force. Problems begin when the outer rings begin to weaken or tear. If the gel presses on the rings and distorts them but stays contained, that's a disc bulge. If the rings tear and the disc material escapes outward, that's disc herniation. Since we're in Texas, I like the cow pen analogy. The annulus is the fence, the nucleus are the cows. If the cows all crowd to one side of the fence and it bows outward, that's a bulge. If the fence goes ahead and breaks and the cows escape, that's a herniation. Now there is a third type of disc injury called degeneration over time. The disc loses water, dries out, and flattens, which can create a broad bulging around the disc. Disc bulges and herniations usually occur at the back corners of the disc, which is unfortunately exactly where spinal nerves exit. So these injuries often irritate or compress nerves. Symptoms can include low back or neck pain between dull and sharp, muscle spasm or postural distortion, pinpoint nerve pain, or numbness, tingling, or weakness into your arms and legs, the severity of which is going to vary depending on how much the nerve is affected. With conservative care, which is chiropractic plus the strategies in this video, symptoms typically improve in 2 to 6 weeks. However, the disc itself rarely returns to perfect normal, and that means flare-ups usually recur at some point. Our goal is going to be fewer flare-ups, shorter duration, and lower intensity. And the biggest factors in that are going to be mechanics, lifestyle, and consistency of care. With a disc injury, joint motion and alignment in the spine become critical. If the surrounding joints stiffen and misalign, then stress increases at the injured disc, accelerating degeneration and flare-ups. Consistent chiropractic care helps maintain joint motion, load distribution, and spinal resilience. Without it, disc conditions often worsen over time and episodes become more frequent and more severe. The core mechanical problem in disc injuries is compression, especially combined with flexion or twisting of the spine. So during flare-ups, we want you to avoid heavy spinal loading or lifting of things heavy. And especially you want to avoid loading the spine and then twisting. That is always high risk. You also want to avoid sustained bending or spinal flexion. Even mild flexion, like leaning forward to do the dishes, can provoke symptoms to come back. So you want to maintain your normal spinal curves in daily life. You want to sit all the way back and sit very upright. You also want to hinge at the hips or bend at the knees if you need to get down. Hold your phone up at eye level, raise the computer screen, and use a stand-up desk if at all possible. If your car seat rounds your back, then use a wedge pillow to get your pelvis up and keep that low back curve. If your mattress sags, get a new one. If lifting is unavoidable, you have to use proper lifting technique. Keep the spine long, engage the core, and bend with the knees to get down instead of flexing your whole spine. Once you've got the weight up, you need to move your whole body to go in that direction. Never just twist the spine, and always keep the load close to your body. It's important to remember that disc flare-ups involve inflammation, so anything anti-inflammatory is helpful. Focus on sufficient sleep, adequate hydration, no alcohol or sugar, and ice can be helpful for 10 to 20 minutes on, and then let the body warm up for at least an hour before reapplying. These exercise recommendations are generally what help people with disc injuries. And that does not mean that they are right for you or will help you. They are all worth a try, but please go slowly and listen to your body for guidance. Stop immediately if anything you are doing is increasing your symptoms. In that event, please discuss it with me at your next appointment and we'll determine a way forward for you. The most important exercise for low back disc injury is the transversus abdominis activation, or TVA vacuum. The TVA is the deepest abdominal muscle, and it's a corset that wraps all the way around your trunk. It stabilizes the spine and it distributes load away from the discs. When the TVA is weak, the lumbar spine bears more force. When the TVA is strong, load spreads throughout the trunk and helps stabilize those discs. So here's the progression. Stage 1 is going to be supine activations. You're going to start on your back with your knees bent. Breathe and exhale fully, and then when you get here, draw the belly button down towards the spine. That's 1. You're going to work on trying to get 5 reps of just that activation twice daily. And then we're going to move on to stage 2, which is timed holds. The progression looks like this. You're going to hold that for 15 seconds, and then 30 seconds, and then 45 seconds, and then 60 seconds. Small breaths, of course, are allowed here, but the goal is to do 5 rounds of 60-second holds twice daily. Stage 3, you're going to move into a quadrupt position or a hands and knees, and you can see here that as you activate that, you're working against gravity, so it adds an element of resistance. Move through that progression again, 15-second holds all the way up to 60. Once you can do 2 sets, 5 rounds, 60-second holds, you're going to move into stage 4, which is seated. You're going to sit upright, nice long spine. Again, moving through the progression of 15-second holds all the way up to 60. And when you can do 2 sets of that, at this level, you're going to feel automatic core stabilization in daily life, and the increased tone of the muscle will help take pressure off the discs and the low back. There are some additional exercises that are helpful here for strengthening the TVA, and they are planks, dead bugs, and pelvic tilts. I'll go through each of them. It's going to be difficult to show you on this table here, but your planks are just going to be normal planks. You want to make sure that you're doing them as a side plank as well as a front plank, and hold those for as long as you can. These are just great spinal stabilization exercises for everyone to do, but especially for this, they're excellent. Now, dead bugs, you may have heard of these before. You're going to lie on your back once again, and you're going to flatten out that lumbar spine. Bring the legs up and the arms up. Keeping the low back flat, you're going to extend opposite arm and leg, and then come back. Like so. For pelvic tilts, you're going to let those feet hit the floor. And from here, you're just going to round the pelvis under and gently lift that off the ground and come back. And repeat. With any of these, you can do them as much as you want with the planks. Hold them for as long as you want, between 30 seconds and a minute. The dead bugs and the pelvic tilts, do 10 or 15 of them. The dead bugs, you should do those on each side. Forward flexion of the spine for long periods of time can make disc bulges worse, as it moves the disc material backward towards those nerve structures. Gentle extension can reduce nerve pressure by moving the disc material away from the nerves. So here's how we're going to do that. Standing, I want you to lift your sternum upward and keep a nice long low back, and then come back to neutral. Repeat 10 to 15 reps as needed throughout your day. Now you can do this on the floor as well, like a low cobra. Just going to keep the spine long, lift the head and the neck, and begin to peel the chest off the floor, and then lay back down. You can begin to progress this a little deeper as you want. Again, let your body be your guide and go slowly. You can repeat that 10 to 15 times. Now for cervical, what you're going to do is simply head and neck extensions. You can do this standing or seated as long as you have an upright spine. You're going to lift your chin, look straight up at the ceiling, and come back. And again, that exercise can be performed 10 to 15 reps anytime you need it, anytime you're feeling these discs start to flare up and give you a little problem. Again, if these are not right for you, you don't have to do them. Another great stretch for cervical discs, if it is tolerated, is hanging your head off of the bed. This exercise will also provide some amount of traction for the discs. So what you're going to do is lay on your back with the bottom edge of your shoulder blades at the edge of your bed, and then just gently let the head and the neck fall back and hang. You can hang right here. You don't have to move at all. As you get comfortable with this, at some point you can start to add in these arms to get a little deeper stretch through the upper thoracic spine, but that's not necessary. Now start with the goal of 15 seconds and add time as your body allows, up to 2 minutes, but no more than that. This exercise is not without risks. I would not perform this without setting an alarm for yourself and not without someone else present in the home or in the area. Too long in this position could cause drowsiness, and you can end up there for way longer than you anticipated, which creates falling and also vascular risks. Now, most people benefit from some gentle motion right before they get up out of bed and come into a weight-bearing position, especially for your low back discs. So we're gonna have you do these 4 things in bed before you get out and see if that helps. Knees to chest, a gentle rock, a supine twist, and then a child's pose. So you're gonna start on your back, and you're just gonna bring these knees into your chest and gently hug them in here. Let that low back begin to lengthen, and then you can take that into just this gentle rocking side to side. And you can even begin to let the knees start to kind of stir into the hips, and you can rock it one way and then rock another. And that should feel nice and gentle with no load on the spine. Then you want to take one leg long, keep one leg in, and then just twist over gently to one side, and then switch your legs and gently twist in the other direction. If it's too much to do it with one leg, you can certainly just let them both fall over to one side and then go to the other side. And of course, if you want to really extend through that spine, get your knees wide, send your hips back, and reach forward through the hands. And a nice little child's pose here will actually really lengthen that area and provide a bit of traction right before you get out of bed. When you begin to feel these symptoms, then start with chiropractic and self-care as we described in this video. If the symptoms persist, then physical therapy or acupuncture might be a good next step. If you're still feeling symptoms, then spinal decompression therapy is definitely recommended. Decompression is the strongest non-surgical, non-drug, mechanical treatment for discs and is often very effective. If you've gone through all of that and it's been 6 months plus and you're still having symptoms, then medical or surgical care or consultations for those things could be necessary. I hope that this video helps you understand your disc injury and feel more confident about managing it. Remember, with spinal health, consistency matters most. Keep your adjustments regular. Make these exercises and mechanics a part of your routine. That combination gives you the best chance of fewer flare-ups and long-term spinal function.